Hey, welcome to Enroll with Victoria. So let's discuss PPO versus HMO versus PPO. A lot of people, they're new to health insurance or not even new. They just want to know, okay, what's the difference between an HMO and PPO? Because this stuff can be overwhelming. So I want to tell it to you in plain English, okay? And so the main thing with HMO is a health maintenance organization. What it means is it's more structured, okay? So just keep this in mind. They're like, I don't know, a boss. They're gonna tell you what to do, when to do it, how to do it, and who to go see, okay? So basically with HMO, number one, you have to stay in network, okay? Number two, you have to get a referral to see a specialist. Okay, the advantage of that is it's going to cost the plan is going to cost less than a PPO per month. It's going to cost less per month, and so basically, some people like HMO because of the cost of the premium, and some people don't like any premiums. Period. They say just health insurance is just too expensive. But guess what? It gets more expensive as you get older. And so a lot of people don't prepare for this. Okay. All right. HMO is more about maintenance and control and structure. Hey, here are the doctors you can see. You cannot go outside of the network. And we're gonna if we think you need to see a specialist, we're gonna decide it and we're gonna um get your referral. Outside of the referral, you cannot go see the specialist at will. Okay, so that's HMO. All right. Then you have PPO. Okay, PPO. Think of it as giving you more freedom. Okay, so with PPO, it's preferred provider organization. Okay, so a lot of people look at prefer as a better network, and so prefer allows you to go outside of the network as well, and you don't need referrals to see specialists. Okay, so those are the main differences. um, Now a lot of times for individual and family, when I say individual family, I mean those people that are going to pay for their health insurance on their own, and it's not through an employer or a group. Okay, so basically a lot of times it's hard to find a PPO for individuals and families. There was one company that I know of that offered PPO, and all of their plans were kind of pricey, but people liked them because they liked the freedom that they had and they liked the quality of the provider that they could see from the PPO. Okay. And so a lot of times PPO only comes through mostly through an employer's coverage. If it's a mid-size or large employer, 500 and over employers, employees, I mean, then a lot of times they will offer PPO. Now, don't get me wrong, sometimes the group plan with the employer, it stinks, okay? But most of the time, it does give you a PPO network where you're able to go out of state or out of network, okay? Um, Now there's another a group called EPO, and some people are like, "What is EPO?" EPO, I would say, is a mixture of both HMO and PPO. So, um, is the reason it's like HMO is because you have to stay in the network unless there's an emergency. The reason it's like PPO, you don't need referrals to see specialists. Okay, so you got the best of both worlds, and the price is going to be kind of in the middle. Okay, but it's probably going to be more geared toward PPO because you don't need a referral to see specialists and stuff like that. The other thing is with EPO, you might not find it with all health insurance companies, but there are some that do offer EPO, and a lot of people are not familiar with EPO. I know the people in New Jersey are, because I have a lot of clients in New Jersey. Um, but I haven't seen a lot of EPO plans in other states, but they are for the most part some pretty good plans. It gives you more flexibility than an HMO. So here are the plan types. You got HMO, and you got PPO and EPO. HMO is more structured. They're gonna tell you what to do and who to go see. Okay. PPO gives you more freedom. You can go outside the network. You don't even need a referral to see specialists. EPO is kind of like both of them. You're able to, you don't need a referral to see specialists. You can't really go out the network though, depending on what it is. Like if there's an emergency, say you're on vacation, you're out of state, um, and you break your finger or something, you got to go to the emergency room. That is going to be covered. But as far as making appointments outside of the state or outside the network, you're not able to do that. And so just keep that in mind. Some people don't like HMOs because they say they get bad providers or providers that don't really care about their job. Okay, those are people's opinions, but here's what we do know, okay? Do you know how it was when you were in school, right? You got some people that were really smart in school, and you got some that were kind of in the middle, and then you got some with it that just didn't really put any effort and they didn't really do well in school. Same with providers. When I say providers, because these days we don't just have medical doctors, we have nurse practitioners, physicians assistants, and stuff like that. And so all of these people are practicing, and it's up to you what you want. Some people say, I don't want to deal with a nurse practitioner. I want a real doctor. Some say, I'd rather have a nurse practitioner or it don't matter. And so, but they're all called providers. Okay. So everybody making money these days. I mean, I went to an urgent care that was run by a physician's assistant. So you couldn't call them doctor. You had to call them by their first name. And so, but all of this depends on you, your situation, what you're able to afford. You have to look at your situation. If you're not really a sickly person, then maybe you could use HMO or that has nurse practitioner providers or physician's assistants providers. Now, if you're a really sickly person, you want the best of the best, then you might want to go with a PPO plan if it's available. And because you're able to go out and network, some people say, like some people that live in New York and live in Pennsylvania or live in New Jersey say, hey, I want to go see doctors in New York because those are some good doctors there. So I would rather go to New York for care. So then you're going to have to be willing to pay a higher monthly price for your plan so that you can get a PPO and then you're able to go outside the network and you're able to go to a different state to make an appointment. But if you have an HMO, you can't do that. So keep that in mind. I hope this educated you. If it did, just put a comment below. Also, you can comment checklist in the comment section, and I will send you the link to a free checklist. Okay, y'all have a good rest of your day and happy learning.